Hello, my name is Michelle Hatanaka, and I'm doing a presentation on pediatric asthma for Aspen University. The objective today is to identify a target area in clinical practice in need of attention, outline a plan for implementation, describe a model used to apply the plan and barriers encountered, and list the sources used to evaluate the success of the strategy and define some ethical considerations. Pediatric asthma. In the pediatric population, asthma can be a debilitating disease process. Many factors can define the level of disease control these patients can achieve. When asthma education is provided with optimum educational opportunity, the possibility of control is inevitable. This is where the role of the asthma case manager is so vital to increase the asthma control in the pediatric population. The burden of asthma in the United States is rising largely. Education is a key to reducing medication usage and emergency room visits. The Iowa model of evidence-based practice. Quality care is a tool used to guide nurses in making clinical decisions in practice, which define a trigger problem or area and discuss if the problem is happening in their organization. They form a team, assemble and synthesize research, pilot the change with enough research, evaluate the change, and if it will be adopted into practice. The key is to monitor the process, identify roadblocks disrupting the process, and the team will gather the data, reevaluate, and try again. Strategic plan to implement clinical change into practice. This is where we hire a dedicated asthma case manager, design a program to do outreach and to ensure the education is provided in depth to this population. Physicians will send an electronic consult to the asthma case manager, and she'll have the responsibility to provide the tools necessary for the child and family. 85% of asthma patients suffering from asthma in the United States are younger than 40. Children younger than 10 years old also have a high prevalence of asthma. In the US, millions of people unnecessarily miss school and work due to asthma symptoms, and these symptoms can easily be controlled with asthma education. Evidence of improvement outcome. Sources used to demonstrate the data is the evidence collected by the team showing the reduction of emergency room visits and the decrease in medication usage by the pediatric population. Having a positive attitude can help toward the integration of the evidence-based practice. Nurses who are informed about evidence-based practice are more likely to adopt and respond positively. Evaluation of implementation. Evaluation of the quality of care provided to the patient is ongoing. Implementation of the pilot study and the outcome will depend on the patient and the family response. Cost analysis of the implementation will weigh heavily on the decision to implement the plan into practice. Ethical considerations. Ethical considerations are the needs of the patient and the costs of the medications. Co-payment costs for appointments with the asthma case manager may be a substantial burden on the success of the implementation. Benefits must outweigh the risk for the patients. Creating a tool to evaluate the evidence-based practice, the team will have documentation to support the assessment, diagnosis, and treatment of the implementation of the new system. Documentation may promote or discredit recommendation of the new system into clinical practice. Conclusion. Pediatric asthma is a debilitating disease process, highly costly, and without control of the symptoms can impede quality of life. With the proper intervention of an asthma case manager that can follow individual patients at high risk and educate properly to decrease the ill effects of asthma symptoms to the patient and family. The important concern is to remember the process is continual and will change until the team can recognize the benefit to the patient. Any questions? References? References continued. The end. Thank you.